back at work on the grind, It's lunchtime. It's a beautiful day out here today. I'm going to Panera Bread, get my grub on because I am starving. So guys, first I want to say that y'all know I cleaned my car. So if y'all see my car now from traveling, you will be like, oh my goodness. So when I get home, I'm gonna have to clean it out again. Me traveling with my daughters, trash is everywhere. So I'm gonna clean that out when I get home. I'm gonna give y'all a quick peek of that. So it's really not just them. Look, we got coffee cups on the side, charger wrappers, cups, you know, so it's nothing heavy. It's just the fact that I just cleaned my car out and now I got bags and stuff everywhere. You know, got balloons all in the ceiling from Mother's Day. So I will take care of that when I get home today. And so it's Nurses Week this week too, guys. So what I'm gonna do is I am actually gonna do a video. I said I wanted to do a video for the new graduates, the new nurses. You know, I've done that in previous videos, just telling like the different types of jobs you can do within nursing. So I've done that, but this video, I think what I'm gonna do is I am actually going to let them know what my job description is, what I do on a regular basis. What this particular job entails. I work for primary care for a family medicine office. So I am going to give an informative interview in regards to that.
Thanks for choosing Panera. What can I get for you?
Yes, can I get a Chipotle chicken avocado melt half with
Half Chipotle chicken avocado melt.
with a small bowl of the broccoli and cheddar.
And a cup of broccoli cheddar too. For your side, bread, chips, or an apple?
Chips, please.
Chips. Anything else for you today?
A small Coke, please.
Hefty, okay?
Yes, that's fine.
Alrighty. Is that complete your order?
Yes, that's it.
Did you want to cook your pastry today for 99 cents at all?
No, thank you.
And do you have Panera Rewards?
I do not.
Alrighty, let that settle for you. The window, you can go for it.
Thank you.
You're welcome.
So just a little presentation in regards to primary care, family medicine. If they're looking for something more structured as far as hours, this is the place to do it, you know. So guys, perfect. So you guys are gonna have lunch with me today. So what I'm gonna do is I'm gonna try to talk about, you know, like what it is that I do. I've been a nurse now it's almost going on 3 years actually. You know, for you guys that don't know, if you look at some of my previous videos, I'll tell you, you know, half of my career was in city government, public administration. I moved to Rochester, took my boards here, sat here for my nursing, and now I'm a nurse. It's been a struggle because, you know, I had to continue my studies forward. I had to take refresher courses, but once I got here, put my mind to it, became really focused about what I wanted to do, because it was a long-term goal anyway to take my boards and pass them and become a nurse. I did it. So now I started off in internal medicine. Now I'm in family medicine. I would say the only difference with family medicine is that the population is different. So there's about 4 populations I deal with, which is pediatrics, OBGYN, internal medicine, which is, I would just say, the ages of 18 years of age and older. And wait a minute, so is it 3? As I'm talking, it's like I do so much I can't even remember, but as I'm talking, when I think of it, I'll let you guys know. But it's internal medicine, OBGYN, pediatrics, pretty much the whole lifespan. We deal with all ages. Oh, infants. There you go. There was some, which is pediatrics, but we deal with young children too, adolescents, and the elderly as well. So, but the difference is from my other job, I didn't do anything with OBGYN, you know, things like that with pregnant women. My job consists, well, let me just tell you, my hours are from 8 to 4:30. So that's a benefit for the nurses who just want a straight set schedule. If you don't want to be working like 12-hour shifts and things like that, primary care is the way to go. If anything, you may have to stay a little late. Like for me, sometimes I get off at 4:30, but sometimes the doctors may catch me and be like, I need some shots. I never stay no later than 5 o'clock. But if you're looking for set scheduling, this is the type of nursing that you probably would want to look into. My day pretty much starts, I come in, I look at how many providers we have. The office that I work for, we have at least 5 providers, which consist of MDs, nurse practitioners, physician assistants, things like that. So you may hear me refer to a doctor, NP, as a provider. I'm saying doctor, nurse practitioner, or a physician assistant. Really good, look. So I pretty much check my schedule. Like today, we have 99 patients. I'm the only nurse here. Some facilities may have their nurses room to patients, which means you take them back, you call them back, you do the screenings, whatever screenings you have to do for whatever type of visit that they're in the office for, and their vitals, setting up the rooms for the providers. Some offices don't do that. My previous office, we didn't do that. The only time we did that was if the medical assistants got behind and they just needed help. We would step in and help them out or whatever. But here, the nurses are actually assigned to providers. They just started that. I kind of recommended that. Assigned to providers, and we do room the patient. So I do that. Whatever clinical services that the providers may have. Like I said, today I'm the only nurse, unfortunately. Whether it's immunizations for babies, immunizations for adults, ear flushes, any type of injection. Even if you have to chaperone the provider when they're doing different things. We also do procedures in our office. Small procedures like removing cysts and warts and things like that. We place IUDs for birth control. The nurse visits, I handle all of those that come into the office, and which that consists of, like today I had a couple of babies that came in for injections, so I had to follow up with that. So the nurse visit that I had come in today, thus far, it was a baby that needed some shots. people come in for like B12 injections, PPD placements. That's another thing we do. And that's normally for employment or something like that. Birth control shots, the depot shots, I do those. So a nurse visit on top of the regular schedule. So the nurse visits are something totally different. So again, I'm the only nurse here today. So rooming, nurse visits, clinical services. Today we have 3 medical assistants, but I'm the only nurse. So again, that's what the nurse visits are. I also order and handle the pharmacy order. So all of the medications, immunizations, I order that. So I do that. I handle that for the private immunizations and orders. I also handle the VFC, which is vaccines for children. I'm the VFC coordinator for my office, which is handling all of the state medications and immunizations and things like that. So primary care, like I said in my previous video, is a different kind of busy. Like a lot of people talk down on nurses that work for doctors' offices, but it's not that easy. It's no different than hospital or nursing homes. Only difference is the population, the type of patients that you're working with. I don't sit down at all day. I'm up and down, up and down. If I'm down, I'm maybe down for a couple of minutes, and that's it. Another part of my job is I work the inbox. We have an inbox with messages and things like that. So we have INR patients, meaning patients that are on blood thinners. I control and handle all of those patients. Those are messages and patient care that you have to be very particular in handling those cases. So I do those, work the inbox. We also have medication refills where the patients are requesting medication refills. So we have to work that. So alongside the other things, referrals, the inbox, the patient calls and orders when they call in, asking questions. We may even have calls that we have to triage if we're going to tell the patient to go to the hospital or not, or urgent care. So we're doing this the whole time that we're here. So it's not that we're not busy. We are extremely busy. Again, I said we got 99 patients today on top of the inbox, and all of the clinical services that the providers are requesting. So if you're a new nurse out there, you're looking to be nursing, not be nursing, but you're looking to be busy, but you want a set schedule, primary care may be the type of nurse that you would like to do. Right now, the pay is very lucrative with primary care. I've seen positions that start off at $45 an hour. I know some people that's making $100 an hour. Those are mainly like the floaters, the travel nurses that do that. So it's a very lucrative position if you get into it. Second. I am thinking about doing that, which would be like a float travel nurse throughout the county. I'm just trying to see if it's going to work with my schedule or not. So hold on 1 second. I'm trying to think if there's anything else that I could share. I will say every practice is different. They have their own different protocols, and one practice may do this, one practice may not. So, but I will say this. If you're looking to have a really great skill set and you want the office, I would say do family medicine instead of internal medicine. Internal medicine, again, they only work with 18 years of age and up. Family medicine works with the entire lifespan. So, of course, you're going to get to do a lot more things. So, that's a tip for you. The only thing I hate about my job here, working in family medicine, which I don't like to do. I think everybody has something about their job that they don't like to do. Can you guess what it is? I'm gonna give y'all a few seconds to guess while I'm chewing on these chips. Okay. I don't like giving shots to babies. I don't like that. I hate giving immunizations to babies. I don't like it. What's so crazy is for them to be as small as they are, if they've already had their first set of shots, when they come back to the doctor, they see those gloves, it's like they know. They automatically know. It's like I don't like being the bad guy. I just don't. So, there you have it. I just want to let all the nurses out there know that I really appreciate you guys. And I really appreciate the nurses that don't mind helping new nurses. I ran into because I'm the type of person where I ask a lot of questions. I ask questions because I want to know what I'm doing, what could happen if it is not done a certain way, the result of whatever. I'm just a very inquisitive type of person. So when I'm being trained, I ask a lot of questions. There's nurses out there that they really don't want to help. They don't want to help. They don't want to train. And I feel like, hey, did you forget that you were once in the same position where you wanted to know things? You wanted to make sure you did your job well, whatever. I'm actually training a new nurse right now. And I think I tell her more information than she needs to know. And I pretty much tell her I may be repetitive with some information. I may be telling you things you already know. I may be telling you things that you didn't ask. By all means, I just want to make sure that that you know what you're doing. And if you have any questions, that I'm willing to, answer those questions for you. So, yeah. So I'm training a nurse right now, and I don't have no issues, and they don't have no issues with me. I'm not supposed to be drinking this Coke. But at the end of the day, they're gonna know that I was very helpful and I was a really good resource for them. So, If I think of anything else, I will be back a little later to share some things with you. But that's the gist of my situation, my job, what I do. It's a very fulfilling career because you're helping people. You're making people smile. I make people smile all the time. People need good patient care. Patients crave good patient care. So, yeah. It's getting hot in here. So y'all see the balloon back there floating. So I will talk to you guys later today. I'm gonna think to see if there's anything else that I could share with you guys. For all my new nurses this year, congratulations. I did get something. I bought something at a store. It was like a keychain. I want to show you guys that. I thought that was cute. I'm gonna keep it on my keychain. But yeah, I am considering doing floating. Like I said, it's very lucrative right now. A lot of people are capitalizing off of this pandemic because it's a nurse shortage, and they are most definitely paying, mainly the agencies are paying more, you know. So look into that, ladies or gentlemen. Oh, the second part of my lunch, I got some broccoli and cheddar soup. So I made it home. So what I'm gonna do is I'm gonna go ahead and get this trash out of the car so I can get this out of the way because I am feeling some type of way. You know what I'm saying? Okay, so I'm getting this trash out the car. I haven't forgotten about you guys. I am actually going to finish up discussing the role that I do in primary care and family medicine. So I am going to I jotted down a couple of things that I wanted to let you know that I also do. So I'm going to go over those things with you as well. But like I said, if you want like a set schedule, if you want like a set work schedule instead of working like long 12-hour and 10-hour days, primary care is the field that I think that will be good. Where you know, if you have kids, you need to pick your kids up at a certain time. You know, during your interview processing, during your interview process, you can actually let them know and be extremely adamant about, you know, having to be off at a certain time. It's pretty much not mandated hours, like where they can mandate you as a nurse. Meaning, if you work for a nursing home and someone call in on your shift, they can't make you stay and work that shift. So that's like one of the reasons too why I will not work in a nursing home, because I don't have time for people not showing up to work, and then I have to cover their shifts for them. So that is one benefit of primary care and having set hours. So now I'm in the back seat of the truck. So yeah, I did wanted to add that, you know, some of the things that I do too is hearing tests. I do vision tests, screenings. So look in this bag, bunch of gummy bears. So I do screenings. The screenings can consist of like hearing screenings, you know, assessing pain levels, fall screenings for people that's over the age of 65. My balloon just flew out the window. That's the last one. That's the second one today that flew out the window. But fall screenings, depression screenings, anxiety. We also do drug screenings for people that's on, you know, medications that they can easily become addicted to. We do functional status for elderly people, you know, pretty much asking if they have hard time seeing, hearing, if they can do their day-to-day without any type of physical or mental disabilities, things to that degree. Psych audits. Of course, we go over immunizations to see what immunizations might be required at the time of the visit. And we also go through medications to see what medications they're on, to verify the medications that's in their chart. We also reconcile medications, like if they had new medications that needs to be placed in their chart from like other facilities, or if they've gotten a medication from the emergency department or wherever else they have gone that's connected to our system, we will reconcile that medication for them, pretty much so that their medication list can be accurate. So those are some of the things that we do in family medicine. If you decide to go into internal medicine, I think I'm going to save these funds. If you decide to go into internal medicine, it's pretty much the same thing, only in family medicine you do a little bit more, because it's like you're working with everything. You're working with pregnant women, like I said, pediatrics, you know, and all of those visits consist of all different types of setups. Pap smears, people get tested for STDs, we do injections for STDs, we do pain injections, what else we do? Like I said, we do ear flushes, we do all of the immunizations that you could think of that's required. You know, people come in that's going out of the country that need to be caught up or just need certain immunizations. Oh, and another thing that we do at my practice that we didn't do at my last practice, it's almost like we're handling all of the labs too. So, you know, of course, glucose, that's not really what I'm saying right now, but we do test glucose, Hemocolt, but we do like the lab testing. We do pregnancy tests, anything that they would do in the lab, we release the labs, we print out labels, we send it to the lab to be tested. We actually do strep tests. We get the COVID samples that we have to print the labels for and send it out. It's almost like we have a little miniature lab area. Some of that stuff that we do, I feel like we're doing the lab's job for them, because we're pretty much prepping it for them, and when they get it, they just do the testing. So we do that. Some offices, you don't do that. So that's what I'm saying. It depends on where you work, what that office provides, the level of service that that office may provide. Every office is different. So I really do like the office that I work at, because it's just giving me a lot more skill set as a primary care nurse. So I am home to end this video, guys. I know I spoke earlier. I wanted to show you this little key thingy I found in one of the convenience stores as I was coming home. So I just grabbed this up, trying to figure out how I probably just gonna make it into a key ring. And then this little plant here for Nurses Week, the nurse practitioner at my work, she gave it to all of us. And it says Mist and Sea, peaceful, eco-friendly, handmade air plant decor. So she just gave us this, and she also gave us a card. I am going to read to you guys what she said in the card. She said, "Barbara, I know that nursing is not always easy or fun, but I hope you are finding some fulfillment in the amazing work you do to take care of patients. I am so glad you joined the team. Your thoroughness and attention to detail are unmatched. I thank you for helping me do my job better. Happy Nurses Week." So I just wanted to show you this. Yeah. So she's one of the nurse practitioners. I really appreciate her. And it really makes the job, you know, worthwhile, you know, working with people and providers that, you know, appreciate you and you appreciate them. You know, we're learning from each other, most definitely. And we're just getting through it all together on a daily basis. So again, I hope you guys enjoyed this video. I hope you guys enjoyed this video, and happy Nurses Week to all of my nurses, and congratulations to all the new nurse graduates.